Okay, so we're going to talk about chapter 11 today, which is chronic diseases. Happy last week of class, guys. You made it. We're almost there, almost to the end. This is a little bit of a crunch time, so pretty much everything is compact into about 3 days. So please bear with me. I tried not to make a whole lot of assignments this week just because I knew that was what was going to happen. So I'm going to sift through a lot of this. Some of it's pretty obvious, so hopefully you won't get too mad at me for sifting through it. Again, I try to make these videos as short as possible. Please keep in mind that I will try to have everything graded, but please be patient with me. There's a lot of other stuff going on, so please keep that in mind. I'll do my best. I've been trying to respond to emails as quickly as possible. So again, please be patient with me as I try to grade things. The most important topic that I can talk to you about is cardiovascular disease, which is what CVD stands for. Over 80 million Americans have CVD, and it's the #1 killer across the United States in all mortality rates. Most people think that it's cancer, but it's actually heart disease. A projection, so by 2030, over 40% of the United States will have some form of CVD, and there are multiple different types of CVD. So you have peripheral artery disease, stroke, coronary artery disease, high blood pressure, and heart failure, as well as coronary heart disease, which are all types of CVD, again, cardiovascular disease. So coronary artery disease is the artery of the heart, which is buildup of fat and cholesterol into your arteries, which makes blood flow extremely difficult. There are two different types of coronary artery disease. You have atherosclerosis, which is the buildup of fats and cholesterol that block the blood flow in your arteries, and then you have arteriosclerosis, which is the general hardening of arteries. I like to think of that as, you can think of it as a rubber band again if you want to, where our arteries have elasticity in them so the blood flow can get in and out. So think of it that way. If your arteries start to harden, you can imagine how much more difficult it will be for excessive amounts of blood to flow through your arteries, which can be pretty painful. Coronary artery disease results, you guys can look at that. Pretty basic. Stroke, most people don't understand that stroke is actually a part of heart disease. So stroke is a disruption or disturbance of blood flow to the brain, which is typically caused by a blocked or ruptured artery. It's the third leading cause of death in the United States, and it's a very serious disability. Most of the time, if you lose blood to your brain, good things aren't going to happen. So you have two different types of strokes. You have ischemic, struggling today, which is a blood clot blocking the blood to your brain. And the arteriosclerosis, where you have a block again, is the main cause of that. And then you have I struggle to say this word every time, that stroke, which is blood vessels, which burst in the brain, causing a lot of blood. Transient ischemic attacks, which are mini attacks. You can have mini strokes. If you have a mini stroke or someone you know has a mini stroke, that is a full-on sign that a normal stroke is going to happen. So you do need to go to the doctor. A normal stroke is going to happen at some point. A mini stroke does not just go away. That's a warning sign that you have blockage or you have something going on. So make sure you go to the doctor. Don't just consider it to be something mini. It's definitely very large. Peripheral artery disease, which is a dysfunction of arteries in the limbs, so most of the time leg pain and leg numbness. If you don't treat it, then you can lose your limb. Most of the time, peripheral artery disease, they put these nice massagers on your legs whenever you're in the hospital, and that's to help keep blood flow going through your legs so you don't get a clot in your leg, because clots can move from your leg to your lungs, from your leg to your heart, from your leg to your brain. Think about it, the blood is pushing that clot somewhere, so it's easily movable. High blood pressure, that's a very big problem. It's called hypertension. So hypertension is sustained high blood pressure over a period of time. Systolic is the number on top, diastolic is the number on bottom. You really ideally want your blood pressure to be around 120/80. There's new numbers out there, 110/70. I stick with 120/80. That's just what everybody knows. 110/70 is still below 120/80, so it's healthy. Anything above that, you really want to be careful with, in the 120 to 135 range, stuff like that. Unless you've drank coffee, you just ran, things like that. So Heart failure, lack of blood supply often leads to shortness of breath, fatigue, fluid buildup. You can definitely tell when there's fluid buildup. Most people have to have fluid buildup drained out. They stick a very large needle somewhere and they try to syringe it out, which is how they get the fluid buildup out. Cardiovascular disease risk. So age, 70% increased risk over the age of 70. Men are more likely to develop CVD than women. African Americans are at higher risk for hypertension. And Native Americans are at higher risk for stroke. So CVD prevention, everything in this class that we've talked about you can prevent. So anything we're going to talk about today you can definitely try and prevent by eating a healthy and balanced diet, exercising, controlling your weight. Your weight is a big part of that. We talked about obesity being the number one link to most chronic diseases, which is 100% the case. You can control your weight. That is something that you can control, which will help reduce all of your risk for chronic disease. Avoid tobacco at all costs. Smoking anything, everything, chewing tobacco, doesn't matter. Keep alcohol in moderate use. Avoid any kind of drug, whether it be prescription pills, weed, whatever it is. Avoid the drugs. Manage your stress. And always, always, always have regular screenings. If you think that something's wrong, go to the doctor. Nothing bad can come from the doctor unless it's a really big bill. So have a regular screening, have your heart checked up on, go to a cardiologist if you feel like you're having issues, see stress management. There's a lot of different things that you can do. Cholesterol levels are very important as well, so make sure you're eating well. Again, diet and exercise are really and truly big prevention tactics for anything we're talking about today. Warning signs of a heart attack, so chest discomfort, upper body, shoulder, jaw, shortness of breath. Stroke, if someone's having difficulty talking to you, they're not making sense, they're not having complete sentences, dial 911 immediately. My uncle had a stroke. He couldn't communicate with his wife. He was saying words, but he wasn't completing sentences, so he ended up actually passing out from the stroke, hitting his head. And what caused the stroke was a massive tumor in his brain. So please, please, please dial 911. That should be your first response. With CVD, anytime you go to a cardiologist, the first thing that they're going to tell you is a lifestyle change. You need to lose weight. You need to eat right. You need to exercise. You need to get a good enough sleep. That's really and truly what you want to do. You do not want to have to do a corneoangioplasty. You don't want to have a bypass surgery. You certainly don't want a heart transplant. So lifestyle change is the number one thing that you can do that's actually really cheap, really easy, gonna aid you in all aspects of your life. So again, lifestyle change, everything that we've been talking about, everything that we've been preaching through this semester is really going to make a huge impact on your life in more than one way, including cardiovascular disease prevention. Cancer, my least favorite topic. So tumors are typically the result of cancer. Benign means it's non-cancerous. Malignant means that it is cancerous. Metastasized tends to mean that it's spread.
No, it's done.
1.7 million are diagnosed each year. 586,000 deaths. 1,600 a day from cancer. Different types of cancer that you can see. Carcinoma, which is the lining of organs, so breast cancer, ovarian cancer, bladder cancer, colon cancer. Sarcoma is supportive tissue, so blood, bone, cartilage. Lymphoma is immune system, and leukemia is bone marrow, central nervous system. Central nervous system, which is brain or spinal cord. The most frequently diagnosed cancer is typically skin cancer, and then what is the leading cause of cancer deaths? I do believe that is colon cancer. I want to say that that's colon cancer. Risk of cancer, genetic. We can be genetically predisposed to cancer. I have to get genetic markers done for a breast cancer mutation that my mother carries. She's a carrier, so more than likely I have it, so I need to get genetic tested. If you're ever curious about anything, you can get genetic testing for any type of disease that your family may have. It's really important to do. Age, 77% increase after 55. That's super high, so think about it now. The more you take care of yourself now, the less you're going to have to do preventative measures at 55. So again, whatever age you're at, the more preventive measures you do right now are going to help you when you get to these markers. 1 and 2, sorry, I'm having problems seeing my own slide. 1 and 2 men will have cancer, and 1 in 3 women. So statistically, that's just it's horrible. Those statistics are not in anybody's favor. African Americans have the highest rate of cancer, and make sure that you are reducing your risk to any type of cancer-causing agents. Prevention of cancer: don't use tobacco, don't use drugs, control your diet. Sugar is a very big part of cancer, so limit your sugar intake, limit your carcinomas. Physical activity is a huge piece of cancer. The more that you can be active, the more your body's going to be able to fight off infections. Body weight, that's a huge thing too. Alcohol, don't use too much alcohol, infectious agents, radiation, sunlight, stress. Stress can lower your immune system, which causes them not to be able to fight off cancers or tumors or any type of markers in your body. So the weaker your immune system is, the less it can do its job. So try and prevent stress as much as possible. Symptoms, you guys can use the caution there. Diagnosis, I think we can all agree that biopsy is the number one way to diagnose cancer. Chemotherapy and radiation are a big part of cancer. You typically have surgery first, then you go through chemo, then you go through radiation. Those are typically the steps. I really hate that I know that. So just to share with you guys my experiences, if you have any questions with this, unfortunately I do have a considerable amount of knowledge about these things. So my grandmother got diagnosed with colon cancer in about 2010, 2011. From there, she got diagnosed with breast cancer in 2012, so we were just about back to back. After she got diagnosed, she got with breast cancer. My grandfather got diagnosed with lung cancer in 2014. Then he got diagnosed with a brain tumor in 2016. And then from there, my mother got diagnosed with ovarian cancer in 2016. I don't recommend that experience to anybody. She's now cancer-free. Thank the Lord. My grandmother is cancer-free. My grandfather unfortunately lost his battle to his brain tumor with an aneurysm. My uncle has brain cancer, so lots of experience with cancer. So if you have any questions about chemotherapy, radiation, etc., I unfortunately can't answer some of those questions. I'm not a doctor, obviously, so I can't answer a lot of those questions. But if you do want to share with me your experience and we can kind of relate to that, then I'm more than happy to share that with you. Diabetes is a metabolic disorder characterized by production or use of insulin. So more than likely your body doesn't produce insulin, or it has too much insulin. Hyperglycemia, so your blood sugar is too much. So fatigue, stomach, intestinal problems. Different types of diabetes. You have type 1, which is no insulin secretion, autoimmune disease, so the body attacks itself. Type 2 is the most common form of diabetes, which the insulin cells are impaired by cells, and they have insufficient production, so you can't produce it on your own. Usually, sometimes you have to take medication, pills, etc., to kind of push that along. And then some people have gestational diabetes, so when you get pregnant, sometimes you can get diabetes pregnant, and then after you've had your kid, then you don't have diabetes anymore. At risk for diabetes, anybody older than the age of 45, BMI over 25. Again, your body weight has a lot to do with diabetes. If you are eating Twinkies and brownies and ice cream regularly, your body is going to eventually reduce the reduction of insulin because you're putting so much sugar in your body that it can't regulate it. So make sure that you're keeping an eye on that. Also, if you're not being physically active, the less physically active you are, the more at risk you are. If you have a family history of diabetes, if you have high blood pressure, cholesterol, blood glucose levels are higher than normal, or even if you have gestational diabetes. I said that once you have your baby, then you don't have diabetes anymore, but it is a very clear warning sign that you could be developing diabetes. Let's see, symptoms. You guys can look at the symptoms of diabetes. So type 1 diabetes, you're born with it basically. Daily insulin shots or an insulin pump. And then type 2, you develop type 2, oral medications and lifestyle changes pretty much. And then putting it all together, so like I said, through all of these discussions, regular physical activity, nutrition, tobacco use, alcohol use, drug use, or family history is very, very important in preventing all of these chronic diseases. The more you are aware of your family history, the more you can combat all of these things. So I do encourage you to be aware of what you're dealing with before you even deal with it. I am very aware that cancer runs in my family, and I'm very, very aware of how I can do my very best to prevent getting that. I don't want to add any risk on top of it. So when I used to tan, I no longer tan. I definitely wear 30 SPF and do my very best to minimize being outside without sunscreen on. Now, don't get me wrong, I spend a lot of time outside, but I do wear my sunscreen. I eat healthy. I make sure I'm getting my healthy array, my colorful plate. I exercise at least twice a day. I don't smoke. I drink minimally and responsibly. So all of those things are things that I'm keeping in mind because I don't want to add to the risk of me getting cancer whenever it's already so prevalent. So you should do the very same thing of thinking about family history. Okay, I have a family history of cardiovascular disease. I need to prevent that now before it even occurs. Or diabetes, I need to prevent that now before it even occurs. So I do encourage you to kind of take a look at your family history and see what could be coming down the road for you, and kind of take measures to deal with that now versus instead of already having it. That's just the best way that I know how to prevent those things. So if you have any questions for me, please let me know. I'm always available and I'm always happy to answer any questions. I've really enjoyed having you guys this semester. We only have one lecture left. So I will see you guys then. Have a good week.